Hi, I'm Manoj Menon from Spotcheck. I'm the CIO of the company. So we are working on a digital transformation for the healthcare industry, especially when you talk about the hospital. Two aspects comes in. One is within the hospital, and other one is outside the hospital. So when a journey of digital transformation is taken, I think the one important thing is how do you make sure that your patient is center of the digital transformation. That's a very important factor, and it's not about the process, how inside the hospital the process works. It is how the patient outcome is getting better. I think that is the key aspect of any digital transformation in the hospital point. That's one aspect of it. The second aspect, when you're talking about outside the hospital, it's more of how do you take care of information which has been captured outside the hospital, whether they're at home or they're traveling, and you have to marry these two information, and that's how you get the complete picture of patient's journey. And that really gives you a very clear communication to the provider to give a best treatment plan. I think that's the digital transformation which we need to look into. There are aspects which inside the hospital, any HIS solution or EHR solution can take care of digital transformation. But there is an aspect of outside the hospital and patient-centric care. And that is very, very important. Even to the extent when a patient enters to the hospital, where do they park the vehicle? How do we make a transformation and make their life a little more easier? I think that's a very key factor, because what is happening in present scenario is if a patient is going to the hospital, it becomes a cumbersome process. Instead of that, how that journey from home to patient and getting back, how that journey can be bettered along with the patient outcome. I think that's the key of the digital transformation. And somewhere we are diluting this entire thing of digital transformation is key focus, but patient-centric is going in a parallel direction. And that's where most of the applications are getting failed to really transform digitally. So there is a process which has been focused in the hospital, how providers are going to treat the patient, or how the purchase processes are going to happen, how the pharmacy process is going to happen. But the center is patient. I think that is what I really want to focus on. And most of the patient-centric hospital which has transformed digitally is a better outcome for the patient. The treatment plan is better, and there are statistics which talks about the patient care becomes more easier and convenient for the patient, and there is a incentive for the providers to get digitized.